Hello everyone, I am the in-house physician with Indus Health Plus, Dr. Kala Kulkarni. As we all know, October is the time set apart globally for breast cancer awareness. To raise the awareness, to advocate for screening, to encourage the survivors and remember those who have fought the disease bravely. Today we have with us Dr. Shona Nag, who is one of Pune's best breast cancer specialists and leading medical oncologists. She has over 27 years of experience and she has made it her mission to encourage everyone to understand cancer better, especially women. She is the director of oncology department at the Sahyadri Group of Hospitals, Pune. She is also a recipient of numerous awards for her contribution in the field. She has been rewarded for her research in the field too. Welcome, ma'am. Thank you for taking your time for us, and we are very glad to have you on board.
Thank you.
Coming to the topic of discussion, ma'am, what are the early signs and symptoms of breast cancer and that the individual should be aware of, as you have seen innumerable number of patients?
So, I'd like to first of all thank you very much for having me here. And October is celebrated every year as Breast Cancer Awareness Month, and I really think you're doing a great job because this disease is the most common cancer in India today. We are seeing a lot of young and old women affected with the disease. So when you ask me what are the early signs,
Right.
I'd like to mention that sometimes there are no signs for early breast cancer. The
Right.
breast may absolutely be normal, and that is why we encourage women over 35 and 40 to come in for screening, do a
Right.
breast mammography, do screening, because very small tumors that don't cause any problem are not felt to the hand
Right.
can be picked up. Nevertheless, we do encourage women after 20 to do a self-breast exam every month, a week after their period.
Right.
How does this help them? This helps them to know what their normal is. So any feel of the breast which is different, which is abnormal, should be brought to the attention of a doctor. That's one. Two, any lump that you feel, that a woman usually feels while showering. That
Right.
is the commonest situation I get.
Correct.
That I was having a bath and I was soaping myself and I felt this lump, but it was not painful. So I didn't come to the doctor.
Yes.
So I'd like to
right.
point out that early breast cancer is never painful.
Correct.
So
ma'am.
in fact, when a lump pains, it is less likely to be harmful
Right.
than when it is painless.
Exactly.
Then don't forget that you can get lump in your armpits also.
Correct.
So any lump that you feel below your armpits and something that is not going for 2-3 weeks, don't sit on it. It could be just, 95% of breast lumps are benign. That is, they don't turn cancerous. So,
Right.
but don't wait at home. Get the doubt clarified. Go to your doctor. Later signs of breast cancer are any changes on the skin of the breast, any reddening, any orange peel appearance, a bloody discharge from the nipple,
Right.
an obvious, lump seam on one side of the breast, which is quite big, which is pulling the nipple in. So these are the signs of more advanced breast cancer.
These were the points that you would like to differentiate, how to differentiate between a fibroadenoma and
So a
malignant type or a cancer.
fibroadenoma is very common in younger girls. Nowadays, you must understand they are so stressed out. There are so many hormonal changes. The lifestyles are crazy. The diet is horrible. So
Yeah.
many preservatives. And this leads to the breast being a very sensitive organ to hormone changes because
Right.
it's entirely driven by estrogen and progesterone and the changes in a woman's body. So the diet affects the hormones affects the breast. So we're seeing a lot of fibroadenomas now, which are nothing but small mobile lumps in the breast.
Right.
These may be painful, these may be painless, but very, very rarely 0.01% do they ever lead to cancer. So it's nothing to worry about, but it's a good idea to come in and get it checked.
Right.
And some girls come with what we call a giant fibroadenoma. That is really it. It's really large. It's distorting the breast. It's giving them, complexes. It's interfering with their day-to-day activity.
Right.
Then we advise removal. Or anything that is causing symptoms, then we advise removal of a fibroadenoma. But not always.
How frequently should we be doing it, and at what age should we be starting to do it?
I think that's a very, very important question, especially for the young women out there. we should start doing a self-breast exam as early as the age of 20. The right time to do it is 5 to 7 days after your period is over, when the breast is the most relaxed and least likely to be swollen. We recommend there is a way to do it. The first is inspection, that is looking at your breasts in the mirror. The second is feeling. When you feel, do not feel with your fingers like this. Feel with the flat of your palm or your fingers so that any lump will hit the flat. And this is to be done in a clockwise and anti-clockwise direction. You can do it sitting, standing, or lying down. Google has excellent instructions. You should do it every month, and you should do it right till the age, till you're alive. I mean, make it a practice. As age goes by, the breast nature will change, the feel will change. That is age related, nothing to worry about. So start doing it as soon as possible.
As you also mentioning about the screening, right? So could you elaborate on how and why screening is important and all the test modalities that are available for the same?
So again, Doc has asked a very, very relevant and important question. Screening is something we do in a normal person who doesn't have any symptoms. So we do tests as a precaution, as a prevention, so as to pick up any disease early. So for breast cancer screening, the most established method is mammography. And believe me, it is not a normal mammogram or an analog. It is something known as digital mammography. So please ask for a digital mammo. There are 5 or 6 available in the city of Pune and all over India as well. Now, when you get a mammo, make sure you're over 35 or 40 years of age. If you're below 35, our breasts are so dense that you won't see anything on the mammo. At that point, if screening has to be done after the clinical exam, a breast sonogram is what is recommended for younger women. Sometimes after doing the mammo in older women, we may find certain things we need to recheck. That may be done on a sonogram. So a mammo and a sono is done together. And in very rare cases, in cases where there's a very strong family history, the girl is very young, mammo's not working, sono's not picking up enough, a breast MRI is recommended. But that is not for routine screening, only in very, very high risk women.
As we always advocate and we always encourage people, and we tend to let them know, prevention is better than cure.
100%.
So what, according to you, are the best preventive measures that can be taken to avoid, if not avoid, to at least postpone or,
Yeah, I get your point. So I think we need to go back to kind of living a less stressful life. And here is where lifestyle is most important. Now, I understand you have a hurry to achieve, a hurry to get there. But honestly, I think if you don't take care of yourselves, you can't take care of anything else. And I think COVID has taught us that health is invaluable. So as far as lifestyle goes, the same risk factors that hold for diabetes, that hold for heart disease, also hold for cancer, and especially breast cancer. So there are factors that we say that you can change and factors that you can't change. So let's talk of the ones you can change. In terms of lifestyle, obesity is a risk factor for breast cancer. That's definitely something you can work on with exercise and a good diet. Then avoiding too much alcohol, avoiding smoking, again risk factors for all 3 non-communicable diseases. I'm not going to be a party pooper and say don't drink. I'm going to say do it in moderation, don't binge. That is the worst form of alcohol drinking. Don't drink during the week and then, suddenly overload your system with toxins. Doesn't work. The body can't handle it and your cancer risk goes high. So 1 or 2 drinks a week, 1 or 2 pegs a week, maybe 3, fine, but not overboard. Smoking, an absolute no-no. I mean, that is something that you pay for all your life. People stop smoking and get lung cancer 10 years later or breast cancer 10 years later. And then, it's very sad because, they've stopped, but the risk has not stopped. So that's one. These are the most important things. Try and eat fresh food. I know there are a lot of pesticides in our food. Try and eat healthy, eat a lot of grains, proteins. Milk products are okay. There is a myth that milk products are pumped with hormones and you get breast cancer. No, we're not drinking 1 gallon or 2 liters of milk a day. We are drinking 200 ml a day. That is fine. Cow milk is better. It mimics human milk the best. It has the least fat content. So go for that. Then white sugar, I don't really recommend. I'm not saying it feeds the cancer. It's just unnecessary calories leading to obesity, leading to cancer. So if you can avoid white sugar and replace it with dates, honey, or a sweetener like stevia, which is natural, not the chemical sweeteners, those are carcinogenic. So these are the little things you can do for yourself. I cannot underestimate the value of exercise. 30 minutes of aerobics 5 times a week, or 45 minutes 3 times a week, please do it. Please take out the time to do it. It really keeps you not only fit, it keeps cancer away. So these are important. When you eat food, eat vegetables and fruits which are orange, red, and yellow. They're full of antioxidants. Haldi is very good for you. It's an antioxidant. The broccoli, cauliflower, cabbage family is full of antioxidants. So try and incorporate more of this into your diet. And of course, millets. Millets are very good for you as well.
And next, one of the most important questions and very frequently asked ones, ma'am, the usage of oral contraceptive pills. Does the usage of this lead directly to the breast cancer or increases the risk of cancer?
Business about oral contraceptives, you must remember in the olden days when we got OCs, they were very, very high in estrogen. And there was no way of regulating the amount of estrogen, and estrogen is carcinogenic to the breast. 70 or 60% of breast cancers are driven by estrogen hormone. And of course, taking such high quantities of estrogen does put you at risk for breast cancer. So the older oral contraceptives were dangerous. But today, when you look at the OCs, they're a very nice mix of estrogen and progesterone, and they kind of mimic the normal menstrual cycle. So they are pretty safe. So I would say in today's day and age, OC pills are really not a risk factor anymore.
Right. Okay, ma'am.